The Flourish program delivers interdisciplinary, patient-centered care coordination to older adults in our rural areas who have 2 or more chronic conditions.
I'm Brent Wright. I'm the medical director of the T.J. Sampson Family Medicine Center.
My name is James Clements. I'm a third-year family medicine resident here at the clinic.
But we deal with a patient population that's very challenged. We look at patients who are trying to put meals on the table, trying to find work, trying to care for their families, trying to pay for their medications, trying to pay for their health care. When you think about being in the exam room and you see that the patient has so many social issues and so many areas that need navigation, I need some help. This is beyond what I can do in the remaining 5 minutes, 10 minutes that I have in this appointment. Not this, hey, you've really got a lot of problems. Your life's terrible. I hate it for you. Good luck with that. Here's a referral for someone who may see you in 6 weeks.
I had a patient who was always uncontrolled hypertension. If he was sitting here for an hour or two, blood pressure was always perfect. But then a lot of times it was just terrible and we couldn't understand why. We saw him walking down the road and it turns out he was walking 11 miles to our clinic one way and then walking home 11 miles. I believe he's in his mid-70s. That's a patient that definitely qualifies. And you saw the conditions that he was living in. You got to full understanding of how he was the caregiver for his wife. I didn't realize that this patient was illiterate until I saw his pill bottles. And you saw that he had a sun or a moon drawn on the bottle, or the number 2 if he was supposed to take it twice a day.
An older adult in need of services can be referred to Flourish by a health provider or community agency. From there, a community health navigator contacts the client, then conducts an in-depth assessment. The community health navigator presents the client's case summary at an interdisciplinary care team meeting, and this team reviews the case and offers recommendations.
It was interesting. The room was full of students and advisors and with different disciplines, which was really helpful, like pharmacy. And they talked about the assessment process that they go through. It's very complete.
Our community health navigator helps implement the recommendations with the client and their providers.
My name is Mary Mae Hensley, and I am a community health navigator, and I assist the clients. I kind of see their problems and their needs firsthand. I'll talk to the doctors for them. I'll assist them in connecting with resources. I'll contact our community organizer, and we'll work together in getting the clients what they need. Well, sometimes it can just be as simple as going into a client's home and maybe they need rails in their bathroom, or maybe they need a hospital bed. And it's hard for the client sometimes to just come out and say, I need a bed. But when we're in their home and we notice these things, we can go back to the doctor.
I am Darla Handy. I'm the community health organizer for Hart, Barron, and Metcalfe County. We work together on just making sure that basic needs are met. I'm the one that kind of goes out into the community and advocates and pulls those resources together to be able to target those specific needs.
I'm Kim Landrum. I'm the RN nurse manager and the care coordinator for the Family Medicine Clinic in Glasgow. We work closely with Darla and Mary Mae in helping coordinate care for our elderly patients. And they come and we talk about different cases, or if we've seen somebody during the week, I'll say, hey, we had Mr. Smith and he needs some help. Can you go see him? And they're like, sure. Because they always see stuff that maybe we don't see. We're looking at them medically and they're looking at them socially.
I think what's important to understand about this model, it's really about the best care for the patient, and there needs to be a lot of good, effective handoffs that take place. I can't take care of patients, in a singular manner. I don't think any physician can. If someone was in your office and they had abdominal pain and you felt like it was an acute abdomen, you would refer them to a surgeon. We don't think of in medicine, hey, someone has social pain. Someone has issues that they really need that team. And engaging this team allows you to have that, comprehensive approach.
It keeps that patient out of the ER. So it decreases healthcare dollars. It's better for the patients. And it's better for me. This is my favorite part of my job. I really get to know these patients and love them. You really understand your patients better.
I got neuropathy bad, I got diabetes, I have asthma, which I had an asthma attack yesterday, and it's scary when you can't breathe. My doctor had me go to these chronic disease classes, and when I got there the first day, Darla was there, and I've learned a lot more.
Because we had no idea that the programs were available to people like my husband and I. And they helped us in so many ways. And the new pharmacy we have, we love those. I could never imagine a pharmacy now delivering our medicine as far out as we live, but they do. They're just super, you know. If something hits my mind, no matter what the day of the week it is, and the only way I'm going to be satisfied, I call Megan or Leanne. And if they're busy, I leave them a message. They get back with me before the day is over. So they're great.
When she was having problems, we had to call EMS, and we had to call 3 times in 2 weeks. So we needed to find something around us close that we could depend on. And another thing was we really needed to talk to my mom to find out what she wanted in her last years, days, weeks, or whatever of her life. And so Mona really helped with that, trying to talk to her and figure out what her wants and desires were. Because even, for example, the other night, I was so close to calling EMS because I thought my mom was really on the downswing. And I called Mona, she calmed me back down, and she says, okay, what does your mom want? We need to do her wishes. And I calmed down, and I said, okay, all right, I'll wait another day and see how she was. And it was best, you know. And I didn't know. I'm not, you know, I don't have any kind of nursing experience, so I didn't know what to do. So the Flourish has been perfect for us.